by asking you what we're seeing with this slight uptick in our community and just in the state in general. Does this concern you, or what would you want people to know about it?
Well, it certainly concerns us to see these increases in the numbers. But what would really concern us is if we didn't really have a good explanation for it. And as I see it now, the community has been reopening even more. We've had schools now reopening, and with that, the interactions that go along with schools and sports and so forth. So I think what we're seeing is not unexpected, but certainly concerning. We want to follow it. We still want to make sure to emphasize all the precautions that we've been talking about all along, and now is a really important time, because as we look ahead to the colder months and as people start to go indoors for all of these activities, it'll be a different game.
And can you clarify exactly how much of an uptick in our community?
When you look at the day-to-day trends, it really hasn't been much of an uptick.
Mm.
Some days will be a 20 and some days will be an 8. But when you look at it on balance, at most, maybe a slight increase, but we've certainly had a lot more activity because we've been doing a lot more tracing, a lot more quarantining, identifying these cases in the schools, really out of an abundance of caution. So there's been a lot more activity here in the health department, even though the numbers, publicly don't really show much.
Schools, my next topic. So, we're seeing a few cases here and there. Is it what you expected? Do you think it's anything we should be worried about? What are your thoughts?
Honestly, it's not surprising because, a lot of our community works in some fashion with the school. Certainly all of our kids go to school in some fashion, and so to sort of see it kind of descend on the schools, if you will, is not surprising. But thus far, knock on wood, we really only had one transmission that we believe happened within a school. The rest of the activity that we've seen has largely been a reflection of what happens outside of school, and the activities and the gatherings and all the things that we've been talking about. So far so good, but trust me, every time I see a student who's positive, we really dig deep and make sure we can find an explanation for it.
And do you think that maintaining this lower end numbers in schools and transmission not being in school, do you think it's sustainable?
That's certainly our goal. That is our goal. And to be honest with you, the schools have gone above and beyond to keep the children and staff and teachers safe. I think they are in many ways a gold standard for how it could be done indoors. Our kids who have been going to school have been indoors for hours at a time, and that we haven't seen any obvious surges from schools. I think we would have seen that by now if our schools weren't doing the right thing. And so I think what we're seeing is a reflection of the schools and the superintendents and the teachers' long days and weeks of hard work over the summertime, really paying off.
So the numbers in the Saturday and Sunday, I saw 5 cases under age 19 on both of those days. Kind of struck me as interesting with the fact that schools have gone back. Do you attribute the young numbers to that, or?
So I have to look at those ages, because when I looked at it by actual age, a number of them are 18 and 19-year-olds, and so those aren't going to be K through 12 students. So one point to remember about the numbers that we release is that those are numbers as we learn about them, not as of that day or the day before. So, today is Monday. We'll learn about results that came in all, yesterday, but may have been collected in a range of dates, say from Wednesday to Saturday. And so what you're seeing on any given day isn't actually a picture of what happened on any given day. But that, aside, what we saw over the weekend, there are more cases that are in younger kids, and we're seeing this. Those are the cases that we've been talking about in the news, and Penfield and West Irondequoit. Those kids are in those numbers. But like I said, not very many, as far as we can tell, transmissions within the schools. These are transmissions that are happening in school-age children outside of the 4 walls of their schools.
And colleges, we've seen pretty low numbers so far with the local colleges.
Mm-hmm.
Have you heard of anything that we're not hearing about, big parties or
No.
anything concerning?
Trust me, I'm sure there are some gatherings happening, and I think we can all assume that. But I do think we can also assume that our college campus community and the students are taking precautions. Like I said, we are far enough into the school year that if we were going to see something take, hold, we should have seen something by now. And so I do think the college campuses have again stepped up to the plate and have taken the precautions and have done a lot of planning. So I think this is a reflection of their efforts.
And SUNY Brockport, I know at least, is doing the pool testing, the mouth swabs. I was over there a couple weeks ago seeing how they do it, testing 500 kids a week. Seems to be working, but I'm curious, how accurate are those swab tests, in your opinion, and what we've seen with it so far?
I think the science is still early on that. It certainly is promising. I don't see any risk involved with it because the way they've set it up, and I think other campuses have set it up, is it's really an initial pass. It's a way of over-testing, but they're not cutting corners. So if they find anything concerning, they will go back to using the traditional tests that we're comfortable with, that we're used to. And so the whole state is involved in essentially a large trial and error to see if this works. But in the meantime, while we're determining whether it works or not, we're not cutting any corners. So for now, I think it's something to follow, but it certainly isn't there to be widespread adoption quite yet.
So you mentioned something interesting about seeing how school is working and seeing how it can work being inside, even with that many people and, working well. So as we get into the colder months and people have to be inside more, I mean, well, what are you feeling about that with indoor dining, maybe no longer being able to do outdoor? I know a lot of people in my life who still aren't comfortable with indoor dining, but they might have to switch to that. What are you thinking going forward into these months?
As I step back and look at this, I am reminded that none of us has gone through this before. And as much as we can borrow knowledge from what we know about other respiratory viruses, and so far we've been able to borrow quite a bit from influenza, from the common cold, from other, but none of these things is COVID-19. And so we are going to learn for the first time a lot of things about COVID-19 that we didn't have an opportunity to learn about in March and April because it was already kind of the sort of end of winter. But we do know that indoor transmission is much more likely than outdoor. And as the air temperature drops and as the humidity drops, the assumption will be that it is easier to transmit in drier air as compared to humid air. So those are all things we're going to be watching for. We also know the value of masks, and we also know that masks can be incredibly protective, especially indoors. And that was something that we didn't appreciate fully back in March. So I think we're going to be entering a period where it'll be game time again. We will be asking of the community to, again, take these precautions in the interest of themselves and taking care of their friends and family and loved ones. So, but we're watching. As the months get colder, we're definitely going to be watching.
And this was something I was wondering. I know gyms and malls had to get a specific air filtration system. Was that required of restaurants?
That was not required of restaurants, no.
Does that concern you?
The jury is still out as to how much of a role filtration plays, and certainly how much of a role airborne transmission plays. Our belief is that the transmission is primarily airborne from person to person, but once it gets sort of circulated around a larger system, the thought is that it doesn't have as much potency, if you will. I think the gym idea was, again, out of an abundance of caution, given the potential to have a large number of people in an enclosed space, even as large as a gym, for hours or hour and a half. So, but I do think the primary risk is still that person-to-person transmission of respiratory droplets within 6 feet primarily, that we can reduce by wearing our masks, by reducing that time, and by maximizing our distance.
There's really only a few areas that still haven't reopened, like movie theaters, regular theaters, live music venues. Obviously live music, that's a larger group, but movie theaters, some people think that's weird that they haven't opened yet. I mean, what are your thoughts on that?
If we were to open movie theaters, I think the given would be that we would all have to wear masks. Movie theaters are safer in the sense that there isn't generally a lot of talking in a movie theater, not like a bar or a restaurant where there's not only talking, but sometimes loud talking. I think the risks can be mitigated in a movie theater. That being said, it's a large venue, and people are in the dark, and you can't necessarily see, what's going on. You don't have that awareness, and you are fixated on the screen. And so there are, features to movie theaters that do make them more risky. The challenge with a movie theater is that it's a large group of people, and if there were to be an infected person there who didn't wear their mask, that's going to be a petri dish for infection for other people. And so it really comes down to risk and benefit. I like movies like the next person, but if you have to compare movies to other venues, it's a balance.
And is that, I don't know if you know this, but is that in line with what the governor's office is thinking in terms of why they haven't reopened? Because I've done a story with movie theaters and they say they don't know why they're not allowed to open.
You know, I can't comment on the governor's rationale, but I do think it does parallel what we've seen in the science. You know, that was what I put up there in March, and as you can see, theater, concerts, sports venues, that was the bottom right-hand corner. Those are the most risky activities. And so, you know, we laid this out, you know, based on the science, and, you know, the governor more or less followed my plan, if
Yeah,
you will.
still holds true, I guess, yeah.
Yeah. So, but it's not a secret. It's the way the science has unfolded, and so that, you know, the governor has generally followed that. But, you know, you can't open everything at once, and there has to be a pace, a cadence to opening things. And so, I think that's what you're seeing.
Okay. So as far as, again, with going forward into the colder months, and obviously now we have flu, and it was a little bit of a different situation when COVID started. It was a little bit later in the flu season.
Mm-hmm.
So, I mean, what should people know about going into this season, being able to maybe tell the difference between flu and COVID? I mean, is there a way to?
It's difficult. A lot of the symptoms of COVID can be confused with the symptoms of influenza. And so in general, check with your healthcare provider. You know, we don't want people at home trying to make these clinical decisions on their own. You know, I think it's valuable to have a professional available to evaluate what's going on. The consequences could be serious. You know, if somebody is assuming one and it's the other and proceeds accordingly in the wrong way, then that could be a very serious illness for that person's, you know, for that person or their family. So we want people to check with their healthcare provider. You know, the symptom that seems to be unique to COVID that we haven't really seen in the others is this loss of taste or smell. But that, it turns out that's not an easy symptom for a lot of people to discern. You know, once you have it, it's somewhat obvious. But a lot of people wondered, is this what I have? You know, so we want you to check with your healthcare provider. So.
Can you get both?
Absolutely.
You can.
Absolutely.
You can have them at the same time.
There's no reason to think that you couldn't get both at the same time. They're independent of one another. In fact, you know, we see this in the hospital, unfortunately, where somebody's immune system is already sort of taken a hit from one, and then they're susceptible to another. You know, or not even in the hospital. In my office, I see people typically older in age or with other medical concerns. You know, when you're you know, down a little bit, you're susceptible to other things. So.
And of course, every year you're pushing the flu shot, and probably even more this year. But have you seen? I mean, do you think people are taking it more seriously this year, just from what you've seen or heard?
I'll tell you, I think so. I think people are taking it more seriously. I think people understand that they don't want to themselves get sick, and more so perhaps than even in the usual year. And I think that recognition that we don't want to tax our healthcare system too much is also on people's minds as well. Because, you know, that curve that we worked so hard to flatten in April and May really referred to the curve of demand for healthcare services. And if we can blunt that demand and keep our hospitals available to take care of people who need to be in the hospital, you know, in the end, our community wins.
So, do you have any update on a vaccine at all, or anything that people should know about that?
You know, there are trials ongoing. Even here at the University of Rochester, the medical center is participating, I think, in at least 2 or 3 trials. But those data are not yet out. You know, they are still enrolling individuals to participate in those studies. I want to emphasize it's important to enroll people of a diverse background, because that's how we learn about science as it applies to a diverse background. But no, we are not seeing anything yet in the way of a vaccine coming out before the end of the calendar year, for sure. And I would say, you know, even into the spring, it would be very unlikely to have a widespread availability of any vaccine. So I think for the near term, you know, the foreseeable future, it's really about taking these mitigation precautions. You know, the masks, the distance, you know, washing our hands, all the things that we've been talking about. That will be the way we stay the course, at least for the several months to come.
Something that I think there's been some confusion on, even people that I've talked to, is about false positives, and how common is that? I mean, maybe even with this new mouth swab test, is it more common with that? What can you tell us about false positives in general?
So, you know, for those of us in medicine, this isn't a new concept, because every test has a false positive and a false negative rate. And that has somewhat to do with the test itself. It also has something to do with the circumstances in which you get the test. So, before you get a test, you have a clinical suspicion in your mind that says, I think it's going to be this, or I think it's not going to be that. And we do tests in medicine to confirm our diagnostic impression. And we're doing the same thing from a public health standpoint. We're utilizing these tests to confirm or to refute our public health impression. And so it's not new to us to have false positives and false negatives. So when it comes to COVID, the false positive, for example, would be if we use the PCR test in somebody who has already had the infection. They've been under isolation, it's been more than 10 days, they've cleared their infection, but they can remain, quote, positive for months. That test can be positive for months. Is that a false positive? In general, we think it is, because they're not infectious and they're generally not sick. But is the test result positive? Yes. So is that a true positive or a false positive? It depends on your reason for ordering the test. And so it is a little bit muddy. It is a little bit confusing. And I think the best thing to do when it comes to interpreting these tests is to check again with the healthcare provider or check with us here in the health department. So when we order tests, we will coach people through how to interpret that result for that individual or for that family or for that situation. But just because you see a positive doesn't mean you're sick. And just because you see a negative doesn't mean you're not. So when it comes to a public health crisis like this, frankly, I'm more concerned about false negatives. Because a false negative might give somebody a false sense of reassurance that they're, quote, not sick, when in truth, they may be becoming sick depending on when the test is repeated. So it's a complicated picture, and so we can provide information on that, but at the end of the day, we want people to check with a healthcare provider.
If it comes up as negative and it's considered a false negative, would that be because you have the test before or during the incubation period and it hasn't come up yet?
So yes, it can be because you collect the specimen too early in the illness, when the viral load isn't high enough to hit the threshold that the test is designed to detect. So that would be an example of a false negative, yes.
But if you test positive, you had it at some point regardless, correct?
That's generally the meaning right now. So if you've had it, the question is when. And if you have it in the context of symptoms, that generally means that you have had it more recently. But if you get a positive and you're asymptomatic, though, it's a little unclear, because we know that 40% of people are asymptomatic in their active period. And so that's where you have to go back and do the detective work to see when they might have gotten it. And if you've got a good story because they were exposed to somebody who was actively symptomatic, then you would be more inclined to conclude that that was an active, true positive, as opposed to a false positive.
So in what circumstance would you suggest someone get tested again, maybe, if they tested negative and you still have concerns, or how often should people get tested, really? It really depends on everybody's individual circumstances. For the purposes of surveillance, somebody who's, for us as a community, trying to understand what is the true prevalence of COVID in our population, weekly is probably plenty. For an individual person, we know that people who work in nursing homes are getting tested weekly, and they were getting tested twice weekly because the stakes are higher. So part of it depends on the risks of not getting tested. For nursing home employees, the risks of not getting tested are potentially that they have an asymptomatic infection that they're not aware of, and if there's a slip in the protocol, or just by nature, they may introduce that infection into a nursing home that's got grave consequences. So it really depends on the circumstances, but and it depends on the test. It depends on the test too. So in general, I don't advise more than weekly for the average person, but like I said, it really depends on the individual circumstance.